A very good afternoon, one and all. Let's look into the various nucleus disassembly techniques before we actually emulsify them. First would be the classical divide and conquer, which we all began our FECO journey with. A trench is made sub-incisionally going all the way across. The tip at this point would be to sort of retract the sleeve so that maximum tip exposure is there, so that you can engage the deepest part of the nucleus. Upon 80 to 90% of the depth being reached, the trench is complete for this plane. It is rotated by a 90 degree. A third trench is initiated. From center going to the periphery. Be careful when you reach the periphery, you need to lift the FECO tip a bit. A fourth trench is then initiated. Once all the 4 trenches are made, the 2 instruments are placed deep in the bottom of the trench and laterally separated so as to get a good crack. We repeat the maneuvers all across, ending up with the 4 pieces which can then be emulsified. Next would be our stop and chop technique, wherein a similar trench done prior is done. Once the 80 to 90% depth is reached, the 2 instruments are placed at the bottom of the trench. We separate them, get a 2 heminucleuses, which can then be further subdivided using various chop techniques, which one is well versed with, and then can be easily emulsified. Next would be a vertical chop, wherein a FECO probe is embedded in the substance of the nucleus sub-incisionally in the manner. Second instrument goes across, gets positioned in this manner. At this point, the FECO probe needs to be lifted vertically while the second instrument presses on the nucleus vertically, hence a vertical chop, and the nucleus cracks. Next would be a horizontal chop, wherein the nucleus engagement is done in a similar fashion with the FECO probe in the manner, and a second instrument, usually a ball chopper, goes underneath the rhexis margin, hooks across the opposite equator. The 2 instruments then moves towards each other and then laterally separated, getting a crack. A variant of horizontal chop, wherein no vacuum or FECO power is used, would be a soft chop or a wedge mechanical separation, wherein the second instrument, as you see here, a ball chopper, goes underneath the rhexis margin, hooks the equator. The FECO tip itself, acting as a second instrument, mechanically holds on to the nucleus. The 2 instruments are then brought towards each other and we achieve a crack. A similar soft chop, in case of a soft cataract, you can visualize FECO probe just sitting mechanically on the substance of the nucleus while the second instrument traverses through the substance, achieving the separation. Horizontal chop in case of a denser cataract would be difficult. Modification of a horizontal chop in this would be what is called as a submarine chop, wherein the FECO nucleus is held on with a good vacuum with a FECO probe. The second instrument goes underneath the rhexis margin, hooks across the equator. At this point, the second instrument here, the ball chopper stays in place. It is the FECO probe then that travels through the substance of the nucleus in the form of a submarine, and then we achieve a crack. Another variant of horizontal chop would be a double chop or a cross chop, wherein first chop is done using a horizontal chop technique in this manner. The second would be a transverse chop as seen here, getting a 3 pieces. Next technique would be a crater and chop or a separation or a slit, wherein a small crater is made, usually not involving the central portion of the nucleus. This is done so as to have access to the more deeper and a denser part of the cataract. The floor of this crater can then be used to impale on the FECO tip, which can then be vertically or horizontally chopped, getting a good disassembly. In a more denser, harder form of a cataract, we can have a crater done which involves the center in the form of a crater central ball. What it does is sort of debulks the central dense nucleus in this grade of cataracts. It also gives you a 360-degree good access for further vertical or horizontal chopping. Once this is done, you can go ahead with the horizontal or vertical chop to get multiple small pieces in the same manner. It also gives you some space in case of a dense dark cataracts like this, when you have chopped them and you are dealing with multiple nuclear fragments within the bag, which can then be easily emulsified. The next technique would be a 2-hole FECO chop, wherein a burr hole is made in the sub-incisional nucleus in the manner which is then rotated by another 180 degree. The FECO probe then impales onto the substance of the nucleus in the manner in this position. Now, using the second instrument and the first hole made as a crater, we engage the nucleus in this manner with these maneuvers. We get a good nucleus disassembly. Looking at some of the supracapsular techniques of managing this nucleus in case of a softer cataract, what we do is we prolapse the one of the pole of the nucleus out. while the other remains in the bag. The second instrument at this point needs to be positioned in this manner of this tilted nucleus so that the gush of fluid from the phaco probe won't push the nucleus back into the bag. At this point, the half of the nucleus which is above this capsular plane is emulsified directly onto this. Once that is done, the second half gently tumbles on itself and then gets emulsified and aspirated out. This is mainly for a softer cataract. In case of a similar dense hard cataract of a small central dense hard cataract, in case of a hypermature cataract like this, the same tilt technique can be employed, wherein the tilted hard nucleus is held in this vertical position. The second instrument goes behind, usually a ball chopper, it goes behind while the phaco probe impales onto the central port and we actually crush the pieces. So this is the tilt and crush technique, and these pieces can be easily managed. Let's have a look at some of the pre-chopper techniques. This is a my loop in which it has got a lever advancement and retraction of which results in opening and closing up of this loop. At this point, the loop is introduced, the lever is advanced, the loop opens up. Once the maximum diameter of the nucleus is engaged across by the loop, by the slight pronation movement, the ciliary reflex can be seen passing posterior to the nucleus, ensuring the complete engulfment of the nucleus. Once this is done, the lever of the my loop is retracted, resulting in closing of the loop. A second instrument here can be used to stabilize the nucleus at this point. Once the plunger is retracted, it cuts through the nucleus, and second instrument can be used to sort of give a counter traction while the loop is cutting through. Even a hard case of cataracts like this, we can achieve a disassembly without the use of a phaco power. The my loop, the same my loop can then be used to further disassembly of these nuclear pieces in the same manner. The second instrument is used to keep a check on the fragmented nucleuses which tends to move around. At this point, it is difficult to have a look at the ciliary reflex passing behind. One gauge at this point would be to sort of gently nudge the my loop across, up, down or sideways, which gives you a fair bit of idea about the posterior position of the loop. Once this is done, in a similar manner, the lever is retracted, resulting in loop passing across and dividing the nucleus. In a harder grade of cataracts, it is much easier to do phaco with a less phaco energy being used using this technique. And the last pre-chop technique would be using a AIOCMT3 pre-chopper, which has got a sharp and a blunt edge. Using the instrument, we go in with the probe. The sharp edge is embedded onto the substance of the nucleus. The instrument is opened up, resulting in the lateral suppletion, obviously without the use of any vacuum or a phaco power. Once the good lateral separation is ensured, the same instrument can then be used to rotate, and the two heminuclei are further subdivided into smaller pieces, which can then be easily emulsified with much reduction in the phaco power that is used. The blunt end then can be used to ensure the good lateral separation. So this is all, and for probably a femtosecond laser would have been a good add-on, but this is all I could cover in the time given.
Excellent video.
Wonderful.
Only thing I think you missed out, I don't know whether you heard the name of flower petal technique. This was described by Dr. Kumar from Bombay, and it got the best video award probably in AAO. So next time you present that also, but it was an excellent presentation.
Thank you. Thank you.
Thank you very much.
Wonderful presentation. I just wanted to know, you have done all these techniques or you?
Sir, except my loop and AIOCMT3, rest all are my videos. Sir.
Okay.
Yes.
It was a wonderful.
Thank you, sir. Thank you.